Hello, and welcome to your October 2022 Clinical Practice Update. I'm Mike Sugimoto, Paramedic Practice Leader at BC Emergency Health Services, coming to you today from the traditional territories of the Songhees, Esquimalt, and WSÁNEĆ peoples. I'd like to take a moment before we begin to invite you to acknowledge our traditional hosts and honor their welcome and graciousness as we live, learn, and work together, wherever you are. In this month's update, we have a new clinical practice guideline, a medication alert, and a couple of practice reminders. Right off the bat, we have a brand new clinical practice guideline that was published on October 1st. This guideline is to support paramedics and emergency medical responders when dealing with patients who have ingested button batteries. These batteries, when swallowed, can cause serious and in some cases fatal injuries. There actually is some out-of-hospital care that can be provided to these patients, and those of you who have already looked at the new guideline may have had their eyebrows go up a bit when you saw it, because it's honey. For children who are over a year old and who can swallow appropriately and where there are no airway concerns, paramedics and EMRs should consider giving liquid honey by mouth. The idea here is to coat the battery's terminal to limit the amount of damage that it can do. It's important to remember that the search for honey should never delay transport to hospital. Remember, these are true emergencies and they need to be managed as such. The new guideline is live in the BCEHS handbook right now, so go check it out. Next up, for advanced and critical care providers. Because of some supply chain disruptions, there's been a change in the appearance of calcium. The packaging is different, although the concentration and the total dose is the same. On the subject of calcium, we've been reviewing EPCRs and we're noticing that a significant number of patients in cardiac arrest are getting calcium without a clear clinical rationale. This is not an evidence-based practice and should stop. Calcium can be used for patients with suspected hyperkalemia or hypocalcemia, and the rationale for its use needs to be clearly documented. Speaking of documentation, our partners at regional trauma centers have noticed that many of our major trauma patients are being excluded from studies or from follow-up because of documentation errors in their charts. Please take the time and care when you're completing your EPCRs in these patients, and make sure you select the correct options in these major trauma cases. Thinking more generally about communication, we'd like to highlight the importance of standardized reporting during patient handovers as a critical step in improving patient safety. BCEHS's recommended tool is ATMIS-DAMBO. The acronym is there to help you to remember the different parts of the report, and it may seem clunky if you've never used it before. But the structured report tool is designed to help construct a shared mental model of the patient and their clinical status when transitioning care from one provider to another. Our partners in the health authorities are slowly starting to move towards ATMIS to support their own transitions of care, and as more and more people become familiar with the tool, its use will become more routine. In the interim, we strongly encourage you to take a look at ATMIS if you haven't already and get comfortable with how it works. There's information on this in the BCEHS handbook. Last month, we made some changes to the way PCP LifePak 15 monitor defibrillators work. As a result of the change, the LP15 now starts up in AED mode, prompting paramedics to attach electrodes and begin chest compressions. You can skip this step by pushing the lead button when the monitor starts and selecting the appropriate set of monitoring channels, which in this case would be lead 2, lead 1, and SpO2. This will switch the monitor into advisory mode and allow you to take vital signs and acquire ECGs. In some cases, it might be necessary to disable the CPR metronome, in which case you can push the CPR button and make the appropriate selection. This change was intended to promote patient safety by providing paramedics with immediate access to the critical life-saving functions of the monitor and to ensure that users don't inadvertently adjust energy levels while managing a cardiac arrest. One of the side effects of this change is that the monitor will continue to operate in advisory mode, and this is a mode where the monitor is continually keeping track of a patient's electrocardiogram and will alert paramedics if it identifies a potentially lethal arrhythmia. If this ever happens, check the patient first and then manage them appropriately. Remember, treat the patient, not the monitor or its alarms. We'd also like to remind unit chiefs that overdose response kits under the take-home naloxone program are available across the province. Please order your kits from Provincial Logistics under the Kits, Bags, and Supplies heading on the order form. The kits themselves are labeled Narcan, THN. Paramedics and EMRs can distribute these kits to patients, first responders, or bystanders at the scene of an overdose, or to any patient or bystander who asks for a THN kit. Please document the distribution of these kits on your EPCRs for tracking purposes. If you have any kits on hand right now, please take a look and check the expiry date on the naloxone. Some of the lots have either expired as of the end of September or will be expiring at the end of this month. Naloxone may lose some of its effectiveness after its expiry date, so additional doses may be necessary to respond effectively to an opioid overdose. That's it from us for October. If you have any comments or questions, drop us a line at clinicalpractice@bchs.ca. We'll see you next month. Until then, enjoy the fall and stay safe.